people are saying goodbye to the Instagram pixie nose trend because this year it's all about strong noses. Yes, you heard it here. Joining us with more insight is board-certified rhinoplasty surgeon and author of BeYoutiful. I think I said it right. Dr. Deepak Dugar, welcome back to the show.
Thank you so much. It's good to see you both again and good to be here.
All right. Well, I like this trend. I would like to think the days of cookbook nose jobs are a thing of the past. And as we say, Doc, plastic surgery should not leave you looking plastic. So Tell us more. What's behind this natural looking strong nose trend?
Well, I think a lot of people have started to see that these tiny pixie noses, these button noses that were made in the 80s and 90s, not necessarily feeling like they look like themselves anymore. There's a huge trend towards a much more conservative, natural approach with noses. The way you and I do noses, Dr. Worden, we like to do a natural approach, a nose that will last a lifetime. We're not following the current trend. If you look at a lot of the filters today, it's kind of ridiculous. They make the lips huge and the nose is tiny. Who looks like that? So we are going against that and trying to go natural.
So there's a new trend on Instagram where people are calling out the so-called catfish beauty filters. Take a look.
What in the world is this catfish filter? I'd like to look like this, but I don't. What in the world is this catfish filter? I'd like to look like this, but I don't.
Dr. Dugar, you interviewed a number of patients about these sort of impossible beauty standards and not natural altered looks in your book. What did you discover?
I'm going to just spit off some startling statistics. Less than 11% of young girls across the world would identify themselves as beautiful. And it gets worse. As we get older, less than 4% of women use the term beautiful to identify themselves. But here's the flip side that's really interesting. Over 80% of women would describe other women as being beautiful. So what we have here is a perception issue where we're able to be kind to each other, but not to ourselves.
So, Doc, bring it back to the trend, natural looking tweaks. We've talked about thread lifts for the face, but now people are using threads to lift the nose as well. So, Dr. Dugar, tell us your opinion. Why do you say this is such a bad idea?
The anatomy of the nose is not meant for a singular linear piece of thread in order to do much. The bones, the cartilages, they can't be shifted with threads. And so I think the problem is placement is really hard to do. Dr. Worden, you and I studied for 20 years in order to just touch a nose. Dr. Batra, you studied for 20 years before you ever injected a patient's face or do a laser. You can learn a thread lift course overnight. Threads are placed wrong in so many patients. I see them sticking out of the tip of the nose in so many patients. You can feel them, they're rigid. I just don't think it's a natural feel and look for the nose.
Well, I completely agree with Dr. Dugar. In addition to his statement about the complex anatomy, we know that the blood supply there is also really easy to nick, as well as the nerves. I always just worry tremendously about complications. The skin is incredibly thin there, so as scar tissue accumulates or that thread can extrude, you can get a really unwanted result. So this is not a place I would consider putting a thread.
Yeah, and I couldn't agree more with Dr. Dugar. I mean, it's the anatomy itself, that you have all that internal cartilage and bone that's maintaining a infrastructure inside the nose. Guess what? Sutures placed there are not going to take the place of those supportive structures. It may look good for a while, but long term, it won't last.
Couldn't agree more.